Hi everyone, thanks for joining me today. This is just going to be a brief overview of some of the terminology that's going to be associated to hematologic dysfunctions, and some of the basic terminology is going to be important for you to understand so that when we start getting into these specific disease processes, you'll understand why that component of each and why the definition and the terms relate to that certain function or that certain disease process. So I have objectives listed on the next screen, but most of these objectives we are going to cover in class. But here I'm just going to cover the describing of the function of the cells and how that terminology applies to what we're learning today. So first and foremost, let's just look at blood. So blood has two components. There's a fluid portion called plasma, and then we have that cellular portion known as the formed elements of the blood. So plasma contains proteins, electrolytes, clotting factors, antibodies, and anticoagulants. And it's really not a big part of it. If you think about it, if plasma has 90% water, only 10% of it is solutes. And within those solutes, protein is a small part of it, but it's really important. The proteins that are within that small percentage of plasma do a lot, and they do a lot within the functioning of the body itself. Be familiar with the terminology as it relates to red blood cells. So remember that erythrocytes are red blood cells, leukocytes are white blood cells, and then thrombocytes are platelets. And we're just going to give you a little bit of background with the red blood cells. So when we refer to red blood cells or erythrocytes, I might use them interchangeably during class, but they are the most abundant of the cellular components of blood. So they're formed through that process called erythropoiesis, and that primary function of the red blood cell is to transport oxygen from the lungs to the tissue. So it's pretty big. And these cells also help carry carbon dioxide from the tissues back to the lungs, and hemoglobin, that red pigment composed of protein and iron, is really an essential piece of that function. And as we learned in our anemia talk with Dr. Kobrinsky, he really goes into great detail and explains it really well why anemia is such an important topic to talk about with children. And we will use the term also when we're talking about anemia called polycythemia. So that's an above average increase in the number of red blood cells in the body. So it's kind of opposite of what anemia is. So anemia is the reduction, where polycythemia is the above average increase, and certain conditions will increase those numbers, which we'll talk about in class. Our white blood cells, so those are our leukocytes, are the mobile units of the body's protective system. So they're formed in bone marrow and pretty much in almost every bone in a child's body. So they're formed in the marrow and then some of the lymphoid tissue as well. And there's actually 5 different types of white blood cells, and each of those blood cells, white blood cells, have a distinct function, which is why when a child does have an infection, you're going to have physicians that are ordering specific tests or a CBC with a differential, so they can actually look and see, well, what is the causative organism, and why that helps them determine how to treat. So when you have a decreased number in the white blood cells, this is called leukopenia, and this can be caused by immune deficiencies or a deficient immune response, or sometimes in certain bone marrow disorders. So platelets, those are our thrombocytes. So these are cell fragments that can form, and they form what we call hemostatic plugs, and they stop bleeding. So they are synthesized from components in the red bone marrow, and they're stored in the spleen. So a deficiency of platelets can lead to bleeding disorders, and we call that thrombocytopenia. So even as we learned in our cancer lecture, when you have a decreased amount of circulating platelets, it puts that child at risk for bleeding, and we would want to be assessing them for those types of bleeding, being pale, having bleeding gums, and bruising easily, which we'll see again in some of our disorders. So just a good background is listed on here. You want to know the lifespan. So our red blood cells do typically last 120 days. Our white blood cells, just a few days. And that's why a lot of times we don't always see changes right away, especially when we're looking at infection in a child. We'll see an inflammatory response with their CRP, but sometimes it takes a day or two to really see those white blood cells accumulating in the body. And then platelets, keep in mind too, our lifespan with that is 3 to 7 days. So they're always constantly recirculating and replenishing. But when we talk about some disorders, sometimes platelets aren't formed well, or they're misshapen, and that can cause problems with the clotting cascade and clotting factors from within as well. So some of our terminology that's related to deficiencies I did bring up, and I do have them on this screen. So just be familiar with that terminology. One term that I didn't bring up is called pancocytopenia, and that's where if you have a deficiency in all 3 of your red blood cells, platelets, and white blood cells, it's Panco, meaning all-encompassing, means that this can be a disorder that is associated with all three of these. Certain disorders will only have one specifically, but when you do have all three, it is used, this term is used. So a thorough family history is really, really important. It can start with just broad questions such as, is there a family history? Is there any family history of having sickle cell disease or any type of anemias or, you know, a lot of times if there is a bleeding disorder, a family member is going to know and report those symptoms, but sometimes it's very minor and they don't, and it's maybe found later. And we're starting to get better at diagnosing and be able to identify certain factors within the blood that relate to clotting. So hemophilia is one example of that. You also want to measure growth and development. So height and weight, regular basis, and plot out those on growth charts. You want to assess nutrition because some of our anemias are associated with nutritional deficiencies. You want to assess if it's an adolescent child. Are they having missed menses? Are they having heavy bleeding? And that can even occur with adults as well. When looking at the child, you would want to look at their skin. There are signs and symptoms that are associated with anemia per se. So having pallor, maybe having a more flushed appearance. Are there any rashes or is there areas of the body not healing? You'd also want to look for ecchymosis. Remember, ecchymosis is that medical term for bruising. So is there prolonged bleeding or clotting time that's above normal? Has that changed? And then is there edema where there shouldn't be? As we talked before, it's very uncommon for children to experience or have edema. So if you're seeing that, you're going to see a physician do a complete workup, which would include blood as well. Sometimes, and if you think about white blood cell count, remember that a child with a low white blood cell count may be higher risk for infection. We know that it should elevate when an infection occurs, so that would be something we'd be monitoring as well. So here, sometimes you'll see this written out in physician's notes, but we do know that white blood cell counts, as I mentioned earlier, are ordered, and that differential is used because we know that certain, whether is it an inflammatory response, that would be eosinophilic. So when we have our eosinophilic response, that's more of an allergic type response. So just know that it's a guide for diagnosing, and again, helps the provider provide the correct treatment. And those of you who have been in Children's Hospital and those of you who are going, this should look familiar to you. The levels are sometimes slightly lower than for an adult, but not that much of a difference. And that is something that we're really fortunate to have in the hospital. So when you hover over an epic, it's going to give you those test value results, which are, again, very closely resemble that, your norms per se of an adult patient. So it is important that you're familiar with the ranges. It doesn't have to be exact because remember, every textbook is going to be a little bit different. Every hospital is even going to be a little bit different with what they report for the ranges. So what I always tell students is that use what the hospital is using because they're synced up. Whatever they have, for example, Sanford uses Epic, the lab uses that value in their reporting. So you need to use whatever the hospital that you're using now, but typically it doesn't vary much from what you're seeing on this screen. Okay, and then this is just a differentiating out those 5 different types of white blood cells and their functions for you. So not that you need to know this, but I think it's helpful, especially when you're taking care of a patient and you see that these are elevated, it might reflect back to why they're there. All right, so in class, we're going to be talking about specific diseases and disorders. And by listening to Dr. Kobrinski and hearing his talk on anemia, I think that is going to give you a great background and give you some evidence to support why we talk about anemia in this lecture and why we talk about it specifically in children. So I look forward to talking to you guys in class, and thank you for listening.